Hello everybody. October is a breast cancer awareness month and we are here to talk about diagnosis and treatment of breast cancer. Most patients with breast lumps usually present to the general physician or to the oncologist for further evaluation. One of the first investigations we tend to do is a mammogram or an ultrasound to see whether the breast lump does look suspicious of cancer. If it does look suspicious of cancer, the biopsy is the next process that takes place. In the biopsy, we are able to confirm whether the lump is cancerous or a benign lump. Most benign lumps need to be followed up only. But if the lump is cancerous, then we need to do further investigation in the form of a staging scan, which is usually a PET CT scan or a CT scan. Also, the biopsy tissue is further tested for molecular markers such as hormone receptors and HER2 receptors. Once we have all of these reports, which is your staging CT scan or a PET scan and the biopsy along with the receptor report, then further treatment can be designed. Usually breast cancers are divided into 4 stages, stages 1, 2, 3 and 4. Up to stage 1, 2 and 3, we can treat with a curable intent. However, stage 4 cancers are rarely curable, but having said that, most stage 4 cancers have now become a chronic disease where they can carry on with some form of treatment or the other for reasonably long periods of time. In stage 1, 2 and 3 breast cancers, the primary modality of treatment is surgery. Most patients up to stage 3 breast cancers undergo surgery. Now there are 2 types of surgery. One is designed to conserve the breast, the other one is to remove the whole breast. Now these decisions are very complex and needs a multidisciplinary approach to make those decisions. Apart from surgery, a lot of patients also need chemotherapy. They also need targeted therapy if the HER2 receptors are expressed and hormone therapy if the hormone receptors are expressed. Radiation is also a standard part of treatment. Depending upon the indication whether that is required or not, that is usually recommended. In terms of chemotherapy, the standard chemotherapy regime lasts for anything between 4 to 6 months. Chemotherapy is usually given in weekly or 3-weekly intervals, and for most patients it is reasonably well tolerated. The targeted therapy that is given if HER2 is expressed is usually lasting for about a year or so. The main complication for this targeted therapy is some cardiac problem, but otherwise most patients tolerate the targeted therapy reasonably well. If radiation has to be given, it is usually given for about 5 to 6 weeks. And hormone therapy, if the receptors are expressed, is usually given in the tablet form for up to 5 to a maximum of 10 years, depending upon the type of hormone therapy chosen, as well as the severity of the disease. In stage 4 breast cancer, the primary modality of treatment is again dependent upon the receptor expression, whether the hormone receptors and HER2 receptors are expressed or not. Now, if hormone receptors are present, then the main modality of treatment tends to be hormone therapy, which are tablets to be taken at home. If the HER2 receptors are expressed, then the primary modality of treatment are those drugs that work against the HER2 receptors in combination with chemotherapy. And patients usually have a very good response when given it with this combination. If neither of them are expressed, then the standard treatment is a combination of chemotherapy and immunotherapy. The chemotherapy forms the backbone of treatment for those patients whom none of the receptors are expressed, but in the recent past, we have also started adding immunotherapy to improve outcomes. Occasionally, other treatment options such as radiation or surgery may be required to achieve local control. A lot of the breast cancer patients also have disease that already spreads to the bones, and hence bone strengthening drugs such as bisphosphonates are also required to help them strengthen the bones to prevent bone pain and fractures. Overall, the breast cancer treatment has been reasonably successful. The cure rates with up to stage 3 cancers are extremely high with proper treatment. Even with stage 4 disease, breast cancer has now become a chronic disease, and most patients lead life with an excellent quality of life being maintained throughout. Thank you.